services play a large role in American society and that make people feel safe if anything were to happen to them or their family. How would you feel if there wasn't a hospital or doctor available where you live? Have you ever been in a situation where healthcare wasn't available? Access to comprehensive, quality healthcare services is important for promoting and maintaining health, preventing and managing disease, reducing unnecessary disability and premature death, and achieving health equity. This level of health care is not available in many parts of the world, such as developing areas like Africa. Comparing government spending in the United States, being a first world country, and Africa, a third world country, is very different in terms of how much money goes to health care services. In the US, on a per capita basis, which is how much the government spends per person on medical care, they spend $10,739. East Africa's government only spends $25 on a per capita basis. The lack of money towards healthcare services in third world countries contributes to the overall environmental and healthcare problems, according to the US National Research Council. Developing countries have many different environmental problems that lead to health problems, including a lack of safe water, poor sanitation and solid waste disposal, hazardous working conditions, and ineffective pollution control. Unsafe water is estimated to cause over 500,000 diarrheal deaths each year. Contaminated water can transmit diseases such as diarrhea, dysentery, typhoid, and polio. Health costs associated with waterborne diseases such as malaria, diarrhea, and worm infections represent more than 1/3 of the income of poor households in sub-Saharan Africa. The poor disposal of garbage and other waste products increase the number of disease-carrying animals, including rodents and insects. According to New Vision, Uganda's leading daily, sanitation is improving along Uganda's western border to prevent the Ebola virus. When entering the country, people are forced to wash their hands in chlorinated water. They are also checked for fever before entering. The lack of medical treatment and technology also affects third world countries' infant and mortality rates. Infant mortality rates are determined by the number of infant deaths for every 1,000 live births. To get an idea, the infant mortality rate in the United States is 5.8. A third world country located in East Africa, named Somalia, has an infant mortality rate of 94.8. The top 5 leading causes of infant mortality rate are birth defects, such as sudden infant death syndrome, preterm birth and low birth weight, maternal pregnancy complications and injuries. In the United States, mothers are able to receive early and regular prenatal care that can help to prevent any problems that the baby might have in the future. Unfortunately, this technology is not used in some countries, and some countries don't even have national newborn screenings, which is an early identification of disorders in newborns that can affect their long-term health. Malaria, tuberculosis, and HIV-related illnesses are not a death sentence in the Western world, but to people living in developing countries it is. An estimated 1.6 Africans die from these diseases due to lack of medicine available to prevent or treat them. The continent itself only produces 2% of the drugs sold. All other drugs are imported and usually not affordable to buy. A Zimbabwean named Charles Nadaluvu says some nurses give painkillers to sick patients as to treat all drugs. Nurses have little choice because of the lack of medicine that's available. A man from South Africa named Dave Poo says, when you seek medical attention, you are often informed that there is no medication and advised to go to the big hospitals, which most people can't afford. 80% of middle income and below income Africans depend on the public healthcare facilities. These facilities have shortages of medicine, leaving patients to die of curable diseases that could have easily been treated. Different non-government organizations help out in developing countries by gaining research in healthcare development. DTRI International is an organization that helps provide effective medical treatment. According to DTRI International, they aim to bring accurate and effective diagnosis and treatment to the world's poor through the introduction of easy-to-use software incorporating electronic protocols that guide health workers step by step to the correct diagnosis and treatment for each patient. This use of clinical standards of care has shown to be an effective way to improve the quality of the care provided to patients. Village Research is a nonprofit organization that focuses on infrastructure and logistics. They have launched a universal access to vaccines and medical supplies to developing countries. It is currently implemented in 251 centers covering a population of 5.2 million people. Medicine, government spending, environmental factors, technology, and disease all play major roles in the health care that countries receive. First world countries like America are lucky to receive the benefits and medical treatment provided. Developing countries are not as fortunate to have the resources and education to provide quality health care. Without assistance from more fortunate countries, the healthcare conditions of developing countries will not significantly improve.